incredible credentials tonight. Babette, are you on the line?
I am. Thanks so much, Lauren. Thank you. We really appreciate you, your leadership. Thanks for checking everybody in. We really appreciate it. Thank you again. So it's very exciting to hear people from so many different areas dialing in tonight. Amazing. I think we have every state and a few countries covered. It's very exciting. So thank you all for joining us. Welcome to everybody that's dialed in tonight to the Project 2015 private placement call. This is an invitation-only call, so the person that invited you obviously sees something special in you. And tonight we have a very special call with a very special guest. So we're going to introduce you to a life-changing product that is the catalyst to an amazing business that people from all walks of life are having success with. And tonight we have Dr. Sharon Norling on the call with us, and you'll hear from her in just a few minutes. So proper introduction of Dr. Norling. Her reputation precedes her. Many have her book. She is a leading expert in nutritional and functional medicine. As a medical doctor, she is nationally triple board certified in obstetrics and gynecology, integrative medicine, and medical acupuncture. Dr. Norling's expertise is based on her years of clinical experiences, also her faculty position at the University of Minnesota Medical School, in addition to her years of research, extensive research. She's had many roles over her years in healthcare as a nurse. She started as a nurse, a medical doctor, as well as a hospital administrator. She also has testified before the White House Commission on Complementary Alternative Medicine. She has additionally served in multiple leadership roles as medical director and in senior management in 2 large healthcare organizations. She is the author of the best-selling book, Your Doctor Is Wrong, and she currently practices in her integrative medicine center in Westlake Village, California 100, which is now we're actually putting this thing into overdrive with this Project 2015. This product is literally changing people's lives in major ways. So now we're actually going to head on out to our special guest and the medical expert, Dr. Sharon Norling, and see what she has to say about the product. Dr. Norling, welcome to the call.
Oh, thank you so much for that. I'm happy to be here.
You're welcome. So, Dr. Norling, you practice nutritional and functional medicine. You're not the average pill for an ill doctor, so you're very knowledgeable, obviously, in nutrition. What, in your opinion, is different about the ZIL Wellness Formula?
Well, first of all, Babette, I wanted to say that I have never, like you, I have never, ever endorsed another nutrient product, and I absolutely enthusiastically endorse ZIL. But I do it for, several reasons. One is there's faster results with ZIL, and it's so comprehensive and it's so nutrient-dense that it helps everybody. And many of my patients, feel better in, 20, 30 minutes. The other important reason that I recommend it is there's over 100 ingredients in there and 38 superfoods just in one simple, convenient serving. And I'll tell you, this makes for much better compliance, with my patients, because research has actually shown that people who have multiple bottles of nutrients, they're not very compliant even after a short period of time. The other aspect that is very important to me and my patients is that ZIL is completely whole food based, and it's served in a liquid form. Well, that means it's bioavailable, and when something is bioavailable, it actually reaches a cellular level, and that's exactly where it needs to go to be effective.
I appreciate you sharing that. When we were speaking privately, you mentioned that you have never seen as quick as positive clinical outcomes as quickly. How many patients do you currently, or have you started on the product so far?
Over 200. And as a medical doctor, I recommend ZIL to every single one of my patients, and they sample it during their appointment, and they walk out with a canister. Because, I'm in the field of helping people get well and stay healthy. And the only way our bodies get well is by the air we breathe, the water we drink, and the food we eat, or the nutrients that we get. And nobody eats perfectly. So I think it's an absolute requirement for all my patients, and of course my friends and family and everybody that I know.
So that's great. Now talk to us for a minute about lab results, lab changes you've seen in your practice.
Well, this has been actually personally astounding to me as a medical doctor. I see lab values change significantly in a very short period of time, like within a month. And I've talked to cardiologists about it. I've sent them the labs to show the changes. I mean, it's almost unbelievable to me. But every single time I recheck the lab after a patient's been on Zeal for a month or more, it's changed in a very positive way. So, so I can't endorse it more. I also wanted to say that my patients love Zeal. They'll walk in and they'll say, I love Zeal. Now, Babette, I have never heard them say, I love vitamin D or any other nutrient. So that's why every one of my patients starts out on Zeal, gets sampled, and leaves with the canister.
Well, that sounds like obviously a dream come true for a doctor, and especially with as many years as you've been practicing medicine, for increased compliance, quicker, obviously positive clinical outcomes, as well as people feeling better faster. It's pretty amazing company.
So, Dr. Norling, welcome back to the call, and if you would, thanks again for being on the call. We really appreciate that. Would you kind of elaborate on that? Why would you be involved in a business like that?
Well, thank you, Kirby. Well, first of all, as a medical doctor, you have to be in the office seeing patients to generate income. And in the last couple of years, I had a few medical problems, and this helped me to really appreciate how very, very important residual income is. So now with Zervita, I have much more flexibility. I have an opportunity to give back more to my community and family and friends. So residual income is very important.
And we didn't talk about this earlier, Dr. Norling, but the medical profession and insurance, that's all changed a lot in the past few years, has it not?
Yes, it has. And so physicians now are more challenged with payment plans and insurances and seeing so many patients. And you really have to be passionate about what you do because it's not the easiest profession to be in, so you have to just love what you do. But you're right, it's changed a lot.
A lot more paperwork and a lot less cash coming out is kind of my understanding. So that residual income, building something with a product that you're obviously passionate about is a good solution for you. So another question that a lot of people might be curious about, Dr. Norling, is, what's your opinion of this company in general and this, the management of the company, the people that you've worked with in Zervita? What are your thoughts of the culture of the company?
Well, honestly, Kirby, I'll tell you, the quality of the Zervita's leadership, it's the best that I've ever seen. And I have worked for large institutions and, been VP of 2 large healthcare organizations. But the entire Mark and Tracy Jarvis and the whole management team is absolutely outstanding. And from my perspective, it is really an honor for me to have the opportunity to work with Zervita.
Well, we appreciate that, and we consider it an honor to have you around. And just one more kind of thought on that with regards to people that you've worked with. I mean, we really try hard. We talk about, the higher you climb, the more you serve. Do you see that? Do you see a helpful environment here? So I guess the real question people are wondering, hey, if I get involved, is there going to be support? Am I going to be in a supportive, healthy, positive place to build this thing?
Yes, absolutely. And I think not only the management team and the entire leadership, but the ambassadors. Oh, my gosh, they go out of their way, to help everyone in their downline and across their lines. So it is a very, very impressive company and a very, very impressive culture.
Well, we appreciate that. And just one final question, and we talked about this earlier. I wanted to kind of bring this up for people that may be in a similar environment as you. What's your experience been with the single-serving bottles, the ability to quickly sample somebody? You said that pretty much everybody that comes in, they get one of these little bottles and they drink it while they're there, and you said most of them walk out with a canister. So that seems to be working. Don't you consider that kind of unique compared to some of the other things that you've seen, especially pills in a bottle and whatnot? Has that been unique for you?
Yes, it's unique, but what that experience provides is they get to sample it. They get to taste it. They feel good on it. It's not questions that they have before they leave the office. They've already, had the Zeal. And the experience has them, wanting more. One of my patients came back and actually at one time bought 100 of the single-serving, containers in 3 canisters for a family. I mean, I'll tell you, Kirby, sometimes we can barely keep the shelves stocked because it goes so fast. But it's not about selling. It's about, as a physician, it's my responsibility to help people get well and have the best nutrition. And Zeal is just the perfect product for that.
All right, well said. Thank you so much for being on the call and taking time out of your busy schedule to